So the INO-VATE trial was a randomized phase 3 trial that compared physician's choice of standard of care chemotherapy to Inotuzumab ozogamicin, the anti-CD22 antibody-drug conjugate. So that trial, the primary results were published in 2016 in the New England Journal of Medicine by Hago Quintarjan and several of our colleagues. What the study was trying to do was to establish whether or not Inotuzumab ozogamicin had a better complete remission rate and better survival compared to standard of care chemotherapy. What the study showed indeed was that the CR rate was significantly better with Inotuzumab ozogamicin, and the survival was also better with Inotuzumab ozogamicin. And it was on the basis of those data that Inotuzumab ozogamicin was FDA approved for patients with both pH positive and pH negative B-cell ALL that was relapsed or refractory. The findings from the INO-VATE trial, there were very high rates of morphologic complete remission and complete remission without evidence of minimal residual disease for the patients that received Inotuzumab ozogamicin. Historically, as one would expect, those results for patients receiving standard of care chemotherapy were quite a bit lower. It was approximately 70% remission rates with the Inotuzumab ozogamicin versus about 20 or 30% with standard of care chemotherapy. Similarly, survival was also quite a bit better with the Inotuzumab ozogamicin compared to standard of care chemotherapy. One of the sobering findings was that while the survival was definitely better, unfortunately, it was still relatively short. I believe the median survival in the Inotuzumab group was in the neighborhood of about 9 to 10 months. So definitely still room for improvement. What we and others are now trying to understand is trying to identify subgroups of patients that may be more or less likely to benefit from Inotuzumab ozogamicin, trying to understand the toxicity profile better, trying to understand how we can use it in the context of hematopoietic cell transplantation. And it's a lot of those efforts that are currently under investigation right now, largely from sort of retrospective and post-hoc analyses from the INO-VATE trial to try to parse out so we and others that treat this disease maybe have a better way of using the drug.